Welcome to State Insurance USA Cares podcast, where we celebrate the heart of our communities. Each episode, we highlight local charities and nonprofits who are bringing hope, help, and healing to those who need it most. Get ready to be inspired by the amazing stories of people making a difference, because together, we care.
Well, welcome to State Insurance Cares. We're the charitable giving arm of State Insurance USA. I'm Gail Langner. And, you know, everybody deserves access to quality health care. We know that. And today we're actually talking with an organization that's bringing medical care directly to those who need it most. And so joining me today is Dr. Nadine Singh. She is the founder and CEO of Premier Mobile Health Services. And Dr. Singh, thank you so much for joining us today. We really appreciate it.
Oh, Gail, it's my absolute pleasure.
Well, it is wonderful to see you again, truly. I know that Blake and I really had the opportunity to come and tour one of your units, and it's obvious really how passionate you are about what you do. And how did you come to create this?
Oh, I'm going to take a long story and make it a very short story.
Okay.
Because I wrote about the mobile clinic doing my master's back at South University. As an high school dropout, a girl who'd started at GED, I had to imagine it, create it to make it work on paper. And so I thought about a mobile clinic just going out in the community and doing the basic medical screening like high blood pressure and diabetes monitoring and all that wonderful stuff. And I did it for a good grade. But however, the more I wrote it, the more it felt like a reality. And I did get the grade. It was my big master's dissertation, and I put it away and I filed it in my archive. Let's fast forward to 2018, as this was 2015 when I wrote that. I got called. I was working in the ER, and I got called to admit a 24-year-old young African-American. And I'm like, okay, the doctor on the line says, oh, Deanie, he had hypertensive urgency and his kidneys failed. He's in renal failure. He will need dialysis. And I'm like, what? 24-year-old? Yeah. So I opened up the screen and I looked at his labs, and he looked like a 110-year-old coming off a cruise ship from a really good time. High salt diet, and it didn't sit well with me. When I looked at his age, I looked at his numbers, I looked at his weight, I looked at everything. Nothing about him squealed. This guy would have lost his kidney at the age of 24 and needing dialysis. I rushed down to his bedside, and he didn't understand the severity of what he was about to experience and that his life has just changed. And when I asked him when was the last time that he had a physical exam or a screening by a medical professional, he said when he was in high school doing sports physical. Wow. My heart sunk. I remember the mobile clinic. I walk out of his room just teary-eyed, heartbroken, and said this should never happen to another kid. And that's when I walked to the cubby with my physician colleague and says, I'm going to do that mobile clinic. And he said, Deanie, what are you talking about now? And I'm saying, I'm going to do a mobile clinic and go out in the community and help these people who are uninsured. And Joseph was not insured. I had to call nephrologist Dr. Mark Russo, who was so delighted to come take care of this young man. And so I went on eBay and found a mobile clinic in Sacramento, California, and we bought it and brought it to Fort Myers, and Premier Mobile was birthed 8 years ago.
Well, when we took the tour, I can tell you Blake and I enjoyed ourselves so much that day, and thank you for taking time out of your busy day to actually show that to us. For those that are listening today, tell me really, Premier Mobile Health, what kind of people do you serve? Where does your unit go in this area in Southwest Florida?
So Premier Mobile is a healthcare institution that serves all people of all race, all ethnicity, all background. But we do with our mobile clinic is a focus on the marginalized individuals, those who are uninsured, those who are insured but can't afford their they copay. Those
Yep.
who does not meet their deductibles, so they can't get a doctor visit. And so we either have free or a sliding scale fee for those individuals. We go to Collier County, we go down to Immokalee, we go to Bonita Springs at the Cafe of Life, we go to Pine Manor, we go to Suncoast Estate, we go to North Fort Myers, we go as far out as the Lehigh, sometime out into Clewiston. So we're really that clinic that goes to the neighborhood where usually there's no access. We go down to Fort Myers Beach. Hurricane Ian has devastated our Fort Myers Beach area, and so there's no healthcare infrastructure out there. And so there's where we have been going as well. And so Premier is that gap for the healthcare system that makes healthcare happen for those who don't have access.
Mm-hmm. What would be a typical test that you would do, or a checkup that you would do for one of your patients, Deanie?
Just think about going to your primary care's appointment. We're like a primary care on wheel. So, for example, if you had a cough, a cold, COVID, whatever it is, and you come on the clinic, you would call your primary doctor for that test. You could call Premier Mobile, whether it's a blood pressure check, whether it's your thyroid check, whether it's your diabetes check, or even a screening, right?
Right.
Prevention is the key focus of our clinic. If we ounce of prevention keeps the doctor away, right? We grow up on those words. And so we screen to tell you what you have, where you are. And so your medical exams is your way to your health. So at Premier Mobile, we pretty much do all screenings. And if we don't do the screening, we'll provide a referral, whether it's to Lehigh Radiology Regional or any other facilities.
Okay, got it. Well, that's amazing. It truly is. I can't believe all the different places you go. Unbelievable.
Yes, we have grown since the last time you took that tour.
I'm sure you have. Do you know, I know one thing, Deanie, is I know it's not easy to start a nonprofit. I can't even imagine where you began, but what kind of, maybe challenges did you come up against when you were trying to get started? Was it mostly money, or?
So it's so funny. I like to talk about a nonprofit because I remember when I didn't understand. I wrote about it. It sounded good, but then practicality, reality sets in, right?
Right.
So we started as a for-profit, and then I went to the Mobile Clinic Association up in Cleveland, Ohio. When I went there was a big room with 125 other mobile clinic recipients. And they were like, anyone in here that bought their mobile clinic, stand up, raise your hand. And I sat down, no one stood up. And I said, anyone affiliated with a church, the few people, a school, several people, a hospital, more than half the room. Then they asked the question again, anyone else has purchased a mobile clinic on their own? And they're like, Deanie, stand up.
Mm-hmm.
I was the only one.
You were it.
So they give a round of applause, but at that time I didn't realize they were saying, you poor soul. And so after the conference, they came and talked to me and said, you have to dissolve your for-profit. I'm like, what? You got to make it a nonprofit. I'm like, what's a nonprofit? I just took my entire life saving, close all my bank accounts to purchase this unit from Sacramento.
Right.
And they said a nonprofit doesn't mean you don't make profit, but it means you get all the people to help you. And so that same day, I dissolved the for-profit concept, make it into a not-for-profit. And then I started knocking on doors. My God, there was no door opening. I knocked and I knocked and I knocked. They said it would make it easier. Oh, no, it wasn't. I had people telling me that it would never work. it's so noble what you're trying to do, but it will never work in East Southwest Florida. And show me something that I can't do, and I'll show you something that will work and something that I will do. And University of Miami was the first one to say yes. And so when they said yes, it's like all the other doors open financially. Lee Health came on board. United Way came on board. It is still challenging, very, very difficult raising funds for healthcare. You know, a lot of people are also having their own challenges. And so when you try to raise money to take care of other, it is a very challenging and difficult process. So always financial is our burden. And we're always looking for financial help, volunteers, whether you're MD, nurse practitioner, nurses, whatever way you could help in volunteering to help us make our community way much better than it is today.
I was going to ask you about volunteers. Anything that not in the medical profession, somebody, let's say me. I mean, is there anything that I could do to help volunteer, or is it you need to have medical background?
I take all people from all walks of life, because guess what? There's so many different activities that we do at Premier. We have our back to school event where we have people come in from the community like yourself, Gail, that comes in and help us pack the knapsacks for the kids to return back to school. The community donate book bags, books, pencils, all kinds of necessities for the kiddos to return to school. We have our big backpack drive. This year we're doing toiletries, toothpaste, deodorant, socks, underwears, all those beautiful items to give back to the kiddos in these less fortunate communities to go back to school. And so when we collect the supplies, we have individuals like yourself comes in and help us put an assortment of these things out so then we can give back to the kiddos for them to go back to school.
That's great. Like even if I could get a few people from the agency, you know, from state insurance to maybe come and do that. Maybe when we're off, Deanie, let's talk about that, about when that's going to be and when you'll need that. Okay.
Right.
So what do you think?
We also do breakfast with Santa. With breakfast with Santa, we do lots of toys giveaway. And while it's the spirit of festivity and giving back, it also, remember, we talk about Joseph. We screen these children and we teach them the importance of their health and understanding their blood pressure and the reason why we check their blood pressure. And it is it's a mirror to their overall health. And so we use the opportunity to teach them. We have the Lines Eye Care that comes out to do the eye exam. We have the audiology people that comes out and do the earring screening. We wish we had a dental personnel that will come out with us. But in the meantime, these are some of the screenings that we provide for these kiddos returning back to school. And so while it's excitement around the giveaway, it also health is the number one focus.
A good priority. That's wonderful. What do you think you're the most proud about, Deanie? What do you think you're the most proud of?
The team that I've built. My team, and I'm most proud of my team, because a lot of people say, oh, when you talk about Premier, people say, oh, Deanie? No, it's not Deanie. Deanie has built an amazing team of volunteers, staff, my project managers, my operation managers, my COO, my medical assistant, my drivers, my nurse practitioners, all those who have come and volunteered, the FGCU brigade team, the Nova Southeastern PA and nursing team, so many different universities, so many of the community that has donated and give back to Premier. So what I'm most proud about is the amazing amount of people who have joined forces with Premier to make this impact possible.
I love to hear that. Do you know that's what Blake says? When you ask Blake what he's the most proud of, that's what he says.
Really?
So, yes, you have kindred spirit, that's for sure. Well, before we go, Deanie, thank you obviously for taking time out of your day today to be on the podcast today. But how can people reach you? What's the best way to get in touch with you if they want to donate or volunteer or whatever? What's the best way to reach you?
You would always go on our website to www.premiermobilehealth.org. That's Premier, no E at the end, premiermobilehealth.org, or 239-288-7955. 849. We're located at 10676 Colonial Boulevard, Suite 20, Fort Myers, 33913. And you could always send a quick email to info@premiermobilehealth.org. And there's a donation button on our website. You could just go there and donate to help us keep our wheels turning and our doors open.
I love that. Thank you. Thank you, my friend, for being on. And we'll see you soon. I know we're going to be doing a check presentation with the big checks, so we can get that on social media. So,
and I just want to tell you, thank you. And you have been supporting me from day one when Tamika introduced us. And I am so grateful. I am so grateful. That's the reason why I also have my insurance through you.
Oh, do you? Thank you. Oh my gosh, that's wonderful. I didn't know that. That's wonderful. So yeah, Tamika Peters, I met her at American Businesswomen's Association, and she said, you have got to meet Dr. Singh. So, and I think it was probably within the week we did. So I'm glad we did. All right.
Thank you.
Okay, great. Well, thank you. Thanks for being on, and we'll see you soon.
Appreciate you, Gail.
You too.
Thank you for joining us on State Insurance USA Cares. We hope today's story uplifted and inspired you. If you'd like to support or learn more about the incredible work happening in your community, visit stateinsuranceusa.com or call 239-567-9992. You can also visit CaboWaboGym.com. Until next time, be sure to let your sun shine and keep sharing good and positive vibes wherever the waves take you.